Dr. Michael Reinhorn. I'm an ambulatory hernia specialist at Boston Hernia. I'm going to talk about what to expect in the first couple of days after hernia surgery at our practice. The recovery after umbilical and ventral hernia can be pretty different for different people. It really depends on, one, the type of surgery that you had done, and two, how your body reacts to surgery. Our patients who have open hernia surgery, which we do for hernias 2 centimeters or smaller, can be done either with mesh or without mesh. The recovery is fairly similar because we close the hole of the hernia regardless. And in some patients, we only do that. In some patients, we reinforce that with a small piece of mesh underneath the abdominal wall. That mesh could be anywhere from 2 to 3 inches in diameter. It's typically a circle, but does not add any pain to the surgery. If you've had one of those 2 repairs, you're going to be in pain to discomfort on the first couple of days after surgery. These are the worst days, and generally pain is well controlled with Tylenol and Motrin. Ice is done as a second-line approach, and in unusual cases, a prescription pain medication is also provided to help get you through. If you are on a prescription pain medication, constipation is probably the biggest complaint. In fact, we get more phone calls from constipation on very few patients who take opioids than for patients who are in pain. So we oftentimes recommend you take Colace and Senecot to keep your bowels going so that you avoid that post-operative constipation. If you've had laparoscopic surgery, that's more painful. That oftentimes requires a bigger piece of mesh that's anchored around the abdominal wall. And you probably have been given a prescription pain medication. Though if Tylenol and Motrin are enough for you, that's great. It's important to eat to tolerance and not overeat. So if your body tells you to eat, go ahead and eat normally. If your body is not hungry, then it's okay to minimize what you're eating. And then in terms of activity, more activity within reason is better. We don't want you laying around all day. We'd like you to go for short walks. Those first couple of days, move around. It's safe to be a passenger in a car, and if you're not experiencing any pain at some point in those first 2 days, you might be okay to drive. Most people are not ready to go to work those first 2 days and do require either a long weekend or a couple of days to get back on their feet. It's okay to bathe. You have a waterproof dressing on. If it's glue, typically it's just can be washed off. If it's a bandage, it can be removed 48 hours after, but in either case, it's waterproof. And so, you can do normal activities around the house, but we don't want you doing anything heavy lifting, and try to minimize how much you're going to do around the house, because you're going to activate all those core muscles in the abdomen, and it's going to increase your pain. So just take it easy, walk, let other people help take care of you those first couple of days.